All right, I'm going to make this one quick because let's be honest, if you do have ADHD, I've got about 30 seconds before you click over to another video. Today we're talking about ADHD, what it is, how it shows up in teenagers, and importantly, strategies to make it better. So whether you've been diagnosed or if you're wondering if you should go get an assessment or you just want to learn more about the brain, because why not, this video should be really helpful for you. So in terms of what ADHD can look like, it can be kind of subtle. It can be very loud as well, but it can be more subtle. So things like having a really disorganized room, losing your things all the time, your keys, your textbooks, your shoes, not knowing where your things are. So also having to always wear odd socks because you can't keep them together or coordinated or organized. Frequently people with ADHD struggle to attend in conversation. They find their thoughts wandering and zoning out and then coming back and then having to kind of look at someone's facial expression to know what they just said and then to kind of smile and go along with it when really they're really struggling to stay in the conversation, to be present. It can also look like pretty bad procrastination, like just even if there's time given to do homework, just an inability to start until like the night before when the stress of, possibly failing overwhelms the issues in initiating organized work and then just cramming it all the night before. And it's important to note that there are some kind of gendered differences in how ADHD typically manifests. So with younger men, there does tend to be more externalizing symptoms. So when energy gets directed outwards, it's behavioral things. So impulse control, fidgetiness, agitation, and some young people can even be violence, talking excessively, risk-taking behaviors, all that sort of stuff. That's all externalizing kind of symptoms. In women, it can be more internalizing symptoms. So instead of directing energy outwards, young women tend to internalize more. And so that's things like feeling overwhelmed or anxious. Sometimes it's less intense, but more subtle, like being really daydreamy or kind of spacey and not really being able to attend to things. And because these are kind of quieter, quote unquote, symptoms, often in young women, it can go unrecognized or undiagnosed until later in life.